Thank you, Dr. Sarah. Hi, everyone. My name is Hanan Shami. I work with MCHP. I support the Arabic community mainly. And when I say the Arabic community, from all regions, the world. What motivated me to be a cultural broker is cultural brokering found me. I didn't found cultural broker. I was looking for a volunteer job, something around childcare, like to volunteer with a childcare, because I had plans to have my own daycare, and I wanted to study early childhood education. And I gave my resume to the same broker that she supported me when I first immigrated to Canada. And that happened after years. And because I was very isolated, I don't know anyone. So I had big hopes that she will help me find volunteer. And I was surprised to get a phone call from the agency asking me if I'm interested to be a prenatal outreach worker. So the title itself was what motivated me, because I come from a family that my grandmother was a traditional midwife. So right away it came to my mind, it's like, oh wow, is this a sign that I should take this job or no? And since then I've been 10 years with MCHP supporting the Arabic community, and the job itself is very inspiring to me. It helped me grow a lot during those years, and teach me about the importance of the community and being part of the community and advocating for others.
Okay. Thank you, Hanan. This is very interesting. So you're saying that, like, you moved from being someone who accessed the services of the cultural brokers to becoming a cultural broker yourself. That is a very nice process of understanding how it happened. Okay, well, thank you for. Now, so how about if you share with us what is the program about? So the program you're working with, you mentioned the perinatal program, but is that the only one that you're working with, or just tell us so that we understand how your work unfolds?
Yes, no. When I started the first 2 years, I was only a part-time a prenatal outreach worker supporting pregnant mothers with the accessing resources and connecting with doctors, with interpretation. And with time, I became a full-time community health worker, and I upgrade myself a lot, and I start to support on more different programs. So I can share about that more. Like, I want to play a slideshow, please.
Okay.
I want to explain a little bit about my work. As a co-op, we highly value the human relational approach, as we first established a trusting relationship with families by mindfully listening to them and guiding us. So this is the dimension of multicultural health brokering practice that I would like to explain about what I became involved with during those years. Do you want?
Yes, actually, please. Yes, absolutely. We like to know how it happens. Yeah, what does this graphic means? Yeah.
When I started my work, of course, I didn't know what does it mean culturally broker, and with years I became very familiar with that term, as it became part of my life, like not only at work, even with my daily life. A cultural broker, we are called cultural broker because we are bridging a certain ways of being and behaving, because our colleagues in the system, they have their culture. Like, I got to learn that doctors have their culture, I have my culture, my community come from different places in the world, have their own culture. So this is the unique thing, that a cultural broker teach me how to bridge between two culture orientations by making every effort in understanding the culture of the formal system and the formal system like the healthcare, the government, and in the same understanding the culture of my clients, and try to do my best in helping both sides have positive relationships. So with the 5 spheres, the dimensions of the multicultural health brokering practice, we have 5 spheres. The 5 spheres, they show the bridging of both sides. As you see, the first 3 circles from personal care, small group development, community development are rooted in the community. Like I work mainly with the one-on-one support with my clients, but at the agency, we have parenting groups as well. We have some of us, some colleagues work in their own ethnocultural community with the faith leaders and the natural leaders. The first 3 spheres are on the side of the community. They are connected together. I will give an example about my work. As a community health worker, when I support the personal care one-on-one, my role mainly is the early parenting, as I help women and their families access Alberta Health Services and resources. I also work with a second project that's called the Culturally Responsive Home Visitation Program. And this is very unique project. It's one of the new projects that I became involved with, where I focus on families who have their first child in Canada, as many are very new to the country and can be unfamiliar with the system. In this program, we are trained in early childhood development, positive parenting, and we focus on creating a rich learning environment for children by supporting the parents. I also work with the FSCD, Family Support for Children with Disabilities, and this is the 3rd program that it's very important to my work with working with families who have children with disabilities, as I connect them to many resources and professionals with a broad network of organizations. So that leaves sorry.
So Hanan, just before you tell us about the other spheres, so how does it look like when you support a family through the home visitation program? So what would be a visit like? How would that look like when you do that?
Yes. This year, I became part of this project, and unfortunately, usually I do my support is one-on-one with home visitation, but I have to do that through video or phone calls. And most of the families will choose the phone call because it's more convenience to them and it's more quick. But we would have like an hour and a half a phone call, okay, where I get a referral. The mom, she's a new immigrant to Canada. She had her first child. So the first thing when I connect to them, I ask like, how can I help you? How can I support you? We talk about her experience here in Canada. How was her pregnancy? How was her experience having the baby? And she would share a lot of things of the struggles that she's facing. Like, as example, it takes time until my families start talking more about that child and focusing about parenting, because they have those multiple issues that they prevent them from focusing in depth on the parenting. Because let's say most of the families are low income, they will have housing issues, income issues, other children who have issues. So we keep it open. Usually it's not a fixed agenda, like we keep it open and it's up to the families what they want to talk about. And with that conversation, we will mention a newborn baby, and we will talk about the parenting and how is the experience for her and what's the struggles. Sometimes with the new mothers, like they still don't have the experience. So if the baby is a little bit sick, they get very scared about that. So I made sure to eliminate most of their anxious feelings about parenting, and we talk in a positive way about the development stages of a child. So if a child is 1 month, we focus only on the first month of the development that's happening with the baby.
Okay.
So I don't overwhelm her with the other months. This is how we do it, like step by step.
Okay. And then so you mentioned that before you were able to do the visits in person. So now it's because of the COVID-19 pandemic that you're only working over the telephone. So what do you notice is the main challenge or difference working remotely now?
Yeah. The first challenges that I still, as a broker, struggle with is I am a very social person. Like my work was always face to face with my clients. I go to their home, they get to see me. This is how we build the relationship. This is how we build the trust. And since the pandemic hit, we have lost a lot of that body cues, the eye gaze, the touch, the conversation face to face, the emotional connection with each other. All these had made the work a little bit challenging, especially with the new mothers. When, after pregnancy, many will have a type of like feeling isolated. Mental health is a big concern, and being in person with that family, it's very important than talking on the phone, because they are already talking on the phone with their families every day. So it's hard. That's a challenge to me.
Mm-hmm. No, of course, it sounds like that. Okay, so that's in the individual. And then you mentioned, if we go back to the spheres, to the graphic. Yeah. So you said you wanted to tell us about other examples of the other ways that you work.
We have the and the fifth spheres, they are tied to the formal system. Those ones are the creating relationship with the institutions, as example, school and advocacy for early learning and the ESL program, and our children and youth who are new to Canada, and with parents as well. As I help connect many parents to go for a school and learn English. Mm-hmm. So we have the policy and program practice considerations, and this is a very unique sphere, as not long ago at the agency, MCHB has invited from the city of Edmonton counselors and the housing advocates, because in Edmonton we have a housing insecurity for low-income families, also for middle-class families, where housing is very, very expensive. So creating the space and the opportunity for families and brokers to sit at the table with city councillors and those housing advocates, so they really get to listen firsthand to the full story and be touched. And when they want to make that change with the policy, take into considerations the families and the struggles that many families in the city are having.
Okay, very nice. So you're working, so it sounds like indeed, so you work with the family at the individual level, but you also notice the importance of working at multiple levels, so that even the city knows what's going on with the families.
Exactly. Sometimes I get to be part of those groups, because it teach me a lot about how I can advocate for in a better way to my families.
Wow. Okay. Well, thank you so much. Now, just maybe if it is okay with you, within the, if people who are looking at the sphere that you're sharing with us, and if anyone wants to become a cultural broker, can they be a cultural broker in any of those spheres? Like, can they be working, let's say, on one-on-one, or can they be working with groups, or with coalition building, or how does that work? If anyone who is listening to us or watching this feel motivated to be involved as well.
Of course, anyone can be a cultural broker. There is no a fixed term or a certain training to be a cultural broker. A doctor can be a cultural broker, a teacher, a social worker, a faith leader, any field, anyone can be a cultural broker as long as they have the capacity to provide a safe space, non-judgmental, and it's very essential that when we support these families, I know we come from a very professional background, but when we get to support the families, it's very important that we give the space, the safe space for the family, and support families to be the decision makers in their own life. So I believe anyone can be a cultural broker.
Oh, thank you.
Also, I want to mention that to be a cultural broker, it's very important to have some type of traditional indigenous wellness and healing networks in diverse communities. It's very important to know the values and the beliefs of the cultural group we are going to support, and having an experience in navigating a formal delivery in the support system is a bonus. So all that can promote anyone to be a cultural broker.
So they need to know the communities that they work with, but they also need to know the systems.
Exactly.
That the families
it's very, very important to know the community they are working with, also because that will give them the knowledge to understand the system as well, because both sides need to work together.
Wow, that sounds very good. Now, in if the people are listening as well, what could be then one of the challenges or biggest challenge that you have faced in doing this work? You said you've been working for 10 years, right? So
yeah.
What do you remember as one of the biggest challenges?
The challenges that I faced is more like my families, the one that I'm supporting them, they face the challenges. Mm-hmm. I, on the personal level, my challenges would be like if I'm unable to support the family's need and try to make things more quick, and maybe supporting my way that won't be benefit anyone. So the challenges is more the families that they are facing. Language barriers is a huge issue when we get to support families, because sometimes they other institutions, let's say a school. Mm-hmm. Not long ago, a week ago, I got a phone call from a school saying that a child, when he needs to be dropped by bus at the home, the family has to be waiting outside. Mm-hmm. So I have a mother that she had a newborn baby. The father is sick, was at the clinic. No one that time was waiting at the door outside. So that frustrated the bus driver, frustrated the teacher. They thought there is a neglect happening. I got a phone call explaining that this family, like what's happening. Like they will start asking me about the family, and then I will explain to them what's happening, because I've been supporting this family for years. So I explained to the teacher about the circumstances of the family, and sometimes it happened like the timing was just 2 minutes before the time that the mom has to go out, but they will give you like, can you please tell them if they don't be waiting on the door on the exact time, next time we will return the boy to the school and we will call children's service. So you see how is that, like it's a simple issue with misunderstanding. It can go further where they create with their imagination that the family is neglecting their child. So that's a challenge that I have to work holistically with both and explain to them the circumstances of the family so we can get to agreement and advocate for the family so they don't fall as victims to children's services.
Wow. So that that role of you knowing the culture or knowing the issues that the family is facing at the moment is very crucial.
Yes.
To help understand, for the school to understand what's going on. Okay.
Exactly. Social distance made our interaction with the families and with the system lose a lot of the nonverbal cues and for the communication part, because sometimes they will send you the referral, but they don't trust you for confidential issues to share more about the family. So they instead of we work together, like every system will be working by their side. So I have to try and bridge those misunderstandings. So we support the family to their best interest.
So in this particular case with the school, how did they know, how did the school know how to contact you?
Most of the families I support, I help register their children in the school.
Okay.
This is what happens when I register the child in the school, especially like children that they have disabilities. I made sure to have my information because the first visit, the first appointment to register a child, I go with the family. So the school board, they will get to meet me and know me, and I explain to them the situation of the family. And it seems they keep my number as a main contact for emergency issues.
So you're able to play that role. In yesterday's webinar, we also learned about how our presenter was Tiffany Poe, how she also had encounters with the school system, and how in her case as well, children's services like child protection could potentially be involved either if you're not able to clarify the situation for the school and the families.
Yeah.
So tell me or tell us, what about when you mentioned about the like you've been working for 10 years, so what are some of the successes or what are the highlights that make you feel, oh yeah, I want to continue being a cultural worker?
Every day comes with a new success to me. With our work, you're not expecting a success to show right away, but you're more expecting like you made a little change in improving a family struggles, let's say, by accessing a certain service or by doing that small conversation, by communicating between the system and the family. Because sometimes families they are so worried that they might not understand the Canadian culture and say something that offend the system, without meaning. So our families, they have a lot of those concerns. Also, what I consider a success is when I follow with a pregnant mom, and we make sure that during her 40 weeks, she had a healthy pregnancy. Those cases are considered a success to me. Sometimes I get to go inside the delivery room with a mother, being there and bridging and supporting the mom and the doctor and understanding each other. It's kind of a miracle to me. It's very, very touching that give me a hope that I have to continue with my work, because it is rewarding on the emotional level, and it helped me be more resilient to life. Like my work have make a huge difference in my life, where it made me more resilient, more understanding, more connected to the community, and it made me more humble about the issues we all human face, and with the support of others, it's very easy to navigate and find solutions.
Wow, so you're saying that success is it's a bit of a collective effort when you said the support from others, right? So when you said support from others, who are these others who support you?
The families I'm supporting, my agency, my colleagues, the system, the doctors that I made a professional relationship with them, all those promote to a good understanding of each other and be connected, because with those hard times, we are unable to work by ourselves, like you need to do that extra effort to be connected to others, because everyone is busy, and it's taking like more time, and it's taking a lot of new learnings. So
absolutely. And so when you say they're working with doctors, or how would that look like then when you work with them? And it's good to know that they support you. And you said, like, you were giving the example of the woman who had a baby. You said you accompanied them for 40 weeks, and then that's so what kind of, yeah, for 4 weeks?
Yeah, 40.
40, yeah.
40 weeks is all her pregnancy, but I continue to support that extra 2 years too. It's not like I have many mothers that they had a baby, after a few months they got pregnant again, so I continue in supporting them.
So the work does not end when the mother has the baby. You keep supporting her.
I keep supporting them based on their needs. There is no limit to the support we provide until the client themselves say, okay, I'm okay now on myself. I speak English. I can go to the clinic. They won't depend on us as like in the beginning as they started.
And what is happening then now with COVID-19? If a mother has a baby, are you still able to go to the delivery room with them or no?
Unfortunately, no. Just 2 days ago, I got a referral. One of the previous families that I supported 3 years ago. So unfortunately, some families lose connection for us for a certain reason or other. So she had a very complicated pregnancy, and where she had premature babies that they born with one of them born with a disability. So usually when I get a referral like that, I go right away to the hospital, and check on the family, see how I can support them. But now, before I start communicating with the family, I have to be connected to the system and try to get some information about that. And sometimes they are not flexible with you. They make it a little bit hard. So, and sometimes the story you hear from the family is totally different from the story that you hear from the professionals that they have been supporting them. So it's taking more time than usual, and connecting everything together and understanding what's happening, so I can provide a good support to them. But so far, I was not able to go in person, no.
Also, they're losing that accompaniment, that moral support and physical support that you were giving them. Oh.
Yeah, like as example, this family, I know them very well. I supported her first when she immigrated to Canada with her first pregnancy. I supported with the registering kids to school. So we have that relationship. Even when I call they don't know, they don't need to see me because they already know me. But imagine it's a family that I got the referral and they don't know me and I don't know them. And I have to advocate and find all these information that is taking like sometimes more than a week. What used to be in a couple of hours is taking more than a week now.
Wow.
Learning
so
about families' needs.
Wow. So that has a direct impact on the quality and the timely services that you can provide. Wow.
Yes, and sometimes the system are not happy when you ask questions. You know, we support families that they have refugees, Syrian refugees, that they have literacy issues. They are not aware and familiar with the health term in asking the doctor the right questions. And sometimes coming on behalf of them and asking about what happened, sometimes they don't share. They tell you, oh, she had a baby a month ago, why you're asking? You know, so
that's when the confidentiality concerns kind of trump your possibility, your ability to support the families.
Yes, now they are asking for a consent form, and it has to be from Alberta Health. Like the consent form that we have is not accepted because you need to make the family sign it, and there is no way I can go to the family and make them sign that because we're not allowed to meet yet. So, and it's taking time, you know, it's taking days. And sometimes they tell you, okay, give us a week, we will reply to you. And now it's 3 weeks, I didn't hear anything.
Wow, okay. So that actually, thank you so much. These are concrete examples of how this COVID-19 pandemic is making things more difficult.
It is making it difficult more for pregnant women as well with prenatal, because before I used to be with them one-on-one. Now many clinics are using the telephone interpretation, and some moms are not comfortable with that because in Canada we have that everyone is equal, male and female are equal. So some women are not comfortable with the interpretation provided by a male because they have a sensitive question that they would like to discuss it more with a female interpreter, and they are not provided with that support.
Wow. Okay. So then, just to wrap up, because we want to give our people with joining us today opportunity to ask questions and make comments as well. So, what do you think will be an ideal support that people can provide to you at this moment to be able, so that you're able, as a cultural worker, you're able to support families? If they could do anything to make things better, what could they be doing right now?
2020 was the most challenging. I noticed things start to become loose. Families became more resilient and more adaptive to the new way. So I'm like, me and the families now are working together to advocate so they get services. So when the family approach that professional, like the doctor or the nurse or the social worker at the hospital, they will, with a conversation between us, they will advocate for themselves and ask for the permission to give me a consent. So the families are learning how to advocate to themselves, you know. It made things more easier because if they are sharing their concerns to the doctor or to the nurse, like, and they get the consent, I don't think they can refuse in helping support that patient.